I would remind members we have no time in hand, and I call Ruth Maguire to be followed by Pauline McNeill. Ms Maguire.
Thank you, Presiding Officer. I was very grateful yesterday to have the opportunity to question Dr Cass at the Health Committee. The landmark Cass report into gender identity services in England is a serious and substantial piece of work which should be considered carefully by all those with an interest or responsibility for children's health. Understanding, of course, that it did not specifically examine services in Scotland, there are a number of principles that Scotland can learn from. For me, the key thing is that it calls on services for children and young people with gender dysphoria to operate to the same standards as other services seeing children and young people with complex presentations and/or additional risk factors. I would hope that that is a principle that everyone would be able to get behind. It states that children and young people referred to NHS gender services must receive a holistic assessment of their needs to inform an individualised care plan, and that should include screening for neurodevelopmental conditions, including autism spectrum disorder, and a mental health assessment. And that standard evidence-based psychological and psychopharmacological treatment approaches should be used to support the management of the associated distress from gender incongruence and co-occurring conditions, including support for parents, carers and siblings as appropriate. Presiding Officer, everything that we know about children and young people points to better outcomes with parental carer guardian support, and I know that many parents will be reassured by the fact that they are mentioned and included in much of the report. It talks to how services should establish a separate pathway for prepubertal children and their families, ensuring that they are prioritised for early discussion about how parents can best support their child in a balanced and non-judgmental way. When families and carers are making decisions about social transitioning of prepubertal children, services should ensure that they can be seen as early as possible by a clinical professional with relevant experience. I note as well concerns about the implications of private health care on any future requests for the NHS for treatment. Presiding Officer, back in 2022, I hosted a meeting for colleagues which gave them the chance to hear directly from people who had detransitioned. I want to take the opportunity to thank Sinead Watson and Richie Herring. They spoke candidly and at times emotionally about their experiences, and I know that colleagues from across the chamber who attended valued their courage and generosity in doing so. I'm pleased that the report states a need for provision for people considering detransition, recognising that they will not want to re-engage with the services whose care they were previously under. I have thought about Sinead and Richie a lot over the last few years, and I hope that improvements to services can help other people, help prevent other people going through the pain and distress that they have. Finally, Presiding Officer, in the report and in committee there was some discussion around conversion therapy. No formal science-based training in psychotherapy, psychology or psychiatry teaches or advocates conversion therapy. It's really important that if we legislate in this place, we don't restrict the ability of therapists to go about their jobs and explore with people the issues that they are having. I said at the start, this is a serious, substantial scientific report. It needs serious consideration. I'll support the Government's amendment and Labour's on that regard. Presiding Officer.